Good evening. Part of my financial practice is helping clients design employee benefit plans. And almost every client I go to today, the first question out of their mouth is, how am I going to pay for this? And why? The politicians in Washington want us to surrender our health care because they're telling us that people can't get coverage because they have pre-existing conditions. If they get sick, their insurance company is going to cancel their plan. And the limit of coverage on their policy isn't enough to cover a major illness. But ladies and gentlemen, in New York, that's not an issue. Because in 1994, our state legislators listened to every one of us and passed a law called community rating. You know what it did? It did away with pre-existing conditions. If you go for health care in-network, your limit is unlimited. And if you get sick, the only reason why an insurance company in New York State can cancel your policy is if you don't pay the premium. So why does New Yorker need national health insurance? We don't. This bill will pay for health care for illegal aliens. The only problem is that they won't pay for it from Washington. We're going to be paying it out of our pockets in increased taxes. Do you want to increase your taxes so illegal aliens can get free health care? I didn't hear you. I got your message. Most companies today, their employees sit down and they decide what type of health care they want. But under this bill, we're going to have a bureaucrat in Washington. He's going to decide what type of health care you need and you need. You know what it's going to be? One size fits all. No good. You're right, it's no good. How many people fit into a size 7 shoe? That's your health care. Does anybody want the government to dictate to you what type of health care you want? This bill will force all businesses to pay for health care for both full and part-time employees and their families. They haven't determined what the premiums are, but they determine how much the businesses are going to pay. For an individual, a business is going to pay 72.5%. That had to be come out of Washington. 72.5%? For a family, the business is going to be responsible for paying 65% of it. And every employee is automatically enrolled. But let me tell you a little thing about family finances. Family finances is like a family budget. There is almost so much money to go around. And when you're asking me to pay for health care, I can't pay that much in salaries. And the bottom line is, people's salaries are going to be cut. But there are going to be some people who are going to lose their jobs. What Congress doesn't understand is American goods and services must be competitively globally, not just against other companies in other states. Recently, Toyota moved their plant out of California and they went to Texas. Half of it went to Texas, the rest of it is going to India and to Japan. The reason why they went to Texas is one simple reason. Actually two. Texas has no income tax. And the cost of doing business there is cheaper. You got it. When Toyota left California, they estimated that 50,000 jobs were lost. Just imagine putting health care on top of this. This bill is wrong. I went through the bill, I read it 3 times. It's still confusing. I don't know who wrote this, but if I want to find out, because he's the scariest guy I can ever imagine. This is what they want to spend your money on. This is only part of what they want to spend their money on. Listen to this. They want to spend our tax dollars $1.95 to pay for people to attend medical school. Listen to that. I'll say it again because I couldn't understand it. $1.95 trillion to send trillion people to go to medical school. What? You want to pay that? Do you want to pay $38.5 billion to build community centers? How about $250 million to build school clinics that will only be open during the school? Understand, these are going to be school health clinics. Now, as parents, do you think you're ever going to be told what goes on in there? Do we need this? Wait a minute, I didn't hear you. One question I think we all asked, no one knows how they're going to pay for this. No one knows how to pay for this at all. But the single thing in this bill that scared the living daylights out of me was the last page. The very last page. It's 13 lines. You know what it says? It says, in order to get this money, the state and every political organization in that state must agree that the federal government is totally in control.